A 2001 clinical trial published in the Journal of Nutrition followed 68 adults with high blood pressure for 4 weeks. Half took their prescribed medication. The other half added one specific food to their daily routine. At the end of 4 weeks, the group that added the food had blood pressure reductions comparable to a low-dose antihypertensive. The food cost less than $2 a week, and almost none of their doctors had ever mentioned it. That food is beet, not beet juice from a bottle, not a beet supplement. Raw or lightly cooked beet, eaten consistently, produces measurable reductions in blood pressure through a mechanism that is completely different from how your medication works, which means it does not replace your medication. It adds to it. And understanding why it works is what makes the difference between people who see results and people who try it once and give up. I am Dr. Michael Lai. In the next 14 minutes, I am going to show you exactly how beet lowers blood pressure, the specific protocol that produced those clinical results, including the amount, the timing, and the preparation that matters, and to other foods in the same price range that work through a third mechanism your medication cannot touch. Stay until the end, because the mistake I am going to show you there is the reason most people who try dietary approaches to blood pressure see nothing after 2 weeks and conclude that food does not work. It does work. They are just doing it wrong. Before we go further, tell me in the comments, are you currently on blood pressure medication? Yes or no? And if yes, how long? I read every single comment, and your answer tells me a lot about what the people watching this channel actually need. Now let me explain the mechanism, because once you understand it, everything else makes immediate sense. Your blood vessels are lined with a layer of cells called the endothelium. The endothelium has one job that is absolutely central to blood pressure regulation, producing a molecule called nitric oxide. Nitric oxide signals the smooth muscle around your blood vessels to relax. When those muscles relax, your vessels widen. Your vessels widen, blood flows through them with less resistance. Less resistance means lower blood pressure. Most blood pressure medications work by blocking hormones, removing fluid, or slowing your heart. None of them directly stimulate nitric oxide production. They reduce pressure through external intervention. Beet works from the inside. It provides the raw material your endothelium needs to make nitric oxide on its own. Here's how. Beet is one of the highest dietary sources of inorganic nitrate on Earth. When you eat beet, bacteria in your mouth and digestive system convert those nitrates into nitrite. Nitrite is then converted by your body into nitric oxide, directly inside your blood vessels, exactly where it is needed. The entire process takes between 90 minutes and 2 hours from eating to measurable effect. This is not a theory. The conversion pathway is documented in peer-reviewed literature going back over 20 years. Polytretine meta-analysis in the European Journal of Nutrition analyzed 16 clinical trials on dietary nitrate and blood pressure. The average reduction across studies was 4.4 mmHg systolic and 1.1 mmHg diastolic. That does not sound dramatic until you understand that a reduction of 5 mmHg systolic in a population reduces stroke risk by 14% and heart attack risk by 9%. We are talking about the equivalent of a low-dose beta blocker from a vegetable that costs less than a cup of coffee. Write beet in the comments right now if you have ever been told to eat more vegetables for your blood pressure. But nobody ever explained which vegetable, how much, or why. Because that is the gap this video exists to close. Now let me give you the exact protocol, because the details matter significantly more than most people realize. Amount. The clinical trials that showed meaningful blood pressure reductions used approximately 12 to 50 grams of beet per day. That is roughly 1 medium beet or 2 small beets. This is not a large amount. It fits comfortably into any meal, but it needs to be consistent, daily. not 3 times a week, not when you remember. Daily consistency is what allows the nitrate levels in your blood to build to the threshold where endothelial nitric oxide production is meaningfully stimulated. Timing. The effects of dietary nitrate on blood pressure peak at approximately 2.5 to 3 hours after consumption and persist for 12 to 24 hours, depending on the individual. This means the optimal time to eat beet is with your morning meal or early lunch, giving it time to take effect during the afternoon hours when blood pressure naturally peaks for most adults. Eating beet at dinner means the peak nitric oxide effect arrives at 9 or 10 at night when you are already at your lowest blood pressure point of the day. You want the benefit during the hours when your blood pressure is highest, not when it is already low. Preparation. This is where most people make the mistake that kills results. Cooking destroys a significant portion of the nitrate content in beet. Boiling beet for more than 20 minutes reduces nitrate content by up to 50%. If you eat canned beet, which is pressure cooked, the nitrate reduction is even more severe. The most effective preparation is raw beet, grated into a salad or eaten with olive oil and lemon. If raw beet is too firm for your preference, roasting whole beets at low temperature, below 180 degrees Celsius, for no more than 30 to 40 minutes preserves most of the nitrate content. This is also why people on ACE inhibitor medications should inform their doctor before adding significant hibiscus consumption. The two can have an additive effect that occasionally drops blood pressure too far. The preparation is simple. Bring 2 cups of water to a boil. Remove from heat. Add 2 to 3 tablespoons of dried hibiscus flowers. Steep for 15 minutes, not the 5 minutes on most package instructions, which consistently underdoses the active compounds. Strain, add a small amount of honey if needed, and drink at room temperature or cold. 3 cups a day is the studied dose. 1 cup in the morning, 1 at midday, 1 in the evening. Brewed hibiscus keeps in the refrigerator for 3 to 4 days, so you can make a large batch twice a week. The third food is garlic, specifically aged garlic extract, which has the most consistent clinical evidence, but raw, crushed garlic achieves a similar effect through a slightly different pathway. Garlic lowers blood pressure through 2 mechanisms. It stimulates nitric oxide production similarly to beet, adding to the nitrate pathway, and it inhibits angiotensin-converting enzyme, adding to the hibiscus pathway. In other words, garlic does both things at once, which is why it appears consistently in blood pressure research across multiple decades and multiple cultures. A 2016 meta-analysis in the Journal of Nutrition analyzed 20 randomized trials on garlic and blood pressure. Average reduction was 8.7 mmHg systolic in hypertensive patients. That is meaningful, comparable to a first-line antihypertensive in mild to moderate hypertension. The effective dose, in most studies, is 4 grams of fresh garlic daily, roughly 1 medium clove, or a standardized aged garlic extract supplement at 600 to 800 milligrams per day. For raw garlic, the key step most people miss is crushing or mincing and then waiting 10 minutes before cooking or eating. Crushing garlic activates an enzyme called alliinase, which converts align to allicin, the active compound responsible for both the cardiovascular effects and the characteristic smell. If you cook garlic immediately after crushing, the heat deactivates alliinase before the conversion is complete. 10 minutes of sitting after crushing gives the enzyme time to do its work. Then cook as normal. Now, I told you at the beginning, there is a mistake that causes people to try this for 2 weeks and see nothing. Here it is. They try one food instead of the protocol. The 3 foods I described today each work through partially different mechanisms. Beet through nitrate and endothelial nitric oxide. Hibiscus through ACE inhibition and anthocyanin antioxidants. Garlic through both pathways simultaneously. When you combine all 3 consistently, the mechanisms compound. Studies on combined dietary approaches to blood pressure consistently show greater reductions than any single food alone, because you are affecting multiple systems at once. The person who eats beet once notices nothing dramatic in 48 hours and concludes food does not work. Miss 2 things. First, the effect is cumulative. Endothelial function improves over weeks, not hours, with consistent intake. Second, a single mechanism acting alone rarely produces dramatic results. The protocol works when all three are present daily for a minimum of 4 weeks. The 4-week timeline is not arbitrary. It reflects the time required for meaningful endothelial adaptation, for the blood vessel lining to regenerate enough new nitric oxide producing capacity to produce a sustained pressure reduction rather than a temporary one. 2 weeks of consistent beet, hibiscus, and garlic will produce some effect. 4 weeks produces the full effect. 6 weeks produces the effect that holds. None of this replaces your medication. Do not change your medication based on a YouTube video. What this protocol can do, and what the clinical evidence supports, is provide an additive effect that in some patients, under medical supervision, creates the conditions where their doctor can consider whether their dose needs to be as high as it currently is. That is a conversation worth having with the evidence in hand. Now, I want to hear from you. Which of these 3 foods will you add first? Beet, hibiscus, or garlic? Leave your answer in the comments. And if this video gave you an explanation that your doctor never provided, which I am confident it did, give it a like, subscribe, and turn on the notification bell, because next week I am covering the single morning habit that raises blood pressure before most people even get out of bed, and how to stop it in 4 minutes. I am Dr. Michael Lee. Food is information for your body. Give it the right signals. I will see you in the next video.